So you have a pain in the very back of your jaw. Guess why? Because it's an impacted wisdom teeth. Hi, my name is Emir. I'm one of the doctors of the Dental Izmir. So let's go and check out how dentists are dealing with the impacted wisdom teeth. Wisdom teeth are getting loose in the evolutionary process. That's why it can be abnormal size, shape, or had an angulation. That's why we have pain in the very back of our jaw. That's why it can get infected through the foods or by just pushing the other teeth. Or it can get an infection due to your food stuck. Due to the anatomy of the area where the impacted teeth has been, there can be a nerve endings or there can be an angle of the bone. You shouldn't use straws or you shouldn't spit or blow air too hard because that makes the blood clots go away and it will affect the healing process. When you do that, the socket will stay dry, so it will get infected and it calls dry socket. So you shouldn't eat gums or jelly beans or something like sticky because it will gonna affect the healing process. After we take out your wisdom teeth, we will gonna suture that area to make sure your gums are very close together so they can heal themselves. So do not mess with the suture because it will gonna affect the suture binding. It can get ripped off. Normally these sutures won't go out by itself, but in the very near end techniques, we have some structures that are reabsorbable. So they can absorb itself and they can go away by themselves. If you have an impacted wisdom teeth and if you don't know what you can do about that, contact with us, Ablauf der Dental Izmir.